Hi, I'm Jeff Holden. Welcome to the Nonprofit Podcast Network. Our purpose and passion is to highlight a nonprofit organization in each weekly episode, giving that organization an opportunity to tell their story in their words to better inform and educate the respective communities they serve, as well as provide one more tool for them to share their message to constituents and donors. Our goal is to help build stronger communities through shared voices and to both encourage and support the growth of local nonprofit organizations through podcasting. Thanks to our founding partners for their foresight in helping us transform the way conversations start. CapTrust, fiduciary advice for endowments and foundations. Runyon Saltzman Incorporated, RSE, marketing, advertising, and public relations creating integrated communications committed to improving lives. And Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. If we haven't experienced it personally, we've certainly seen it. It could have been a family member, sibling, spouse, child, or even dear friend, maybe a coworker. It costs our communities, our workforce, and our families incomprehensible amounts of not only money, but time and energy that could be so much better spent. And it's preventable. It's a difficult and extremely challenging process for those we know with a substance use disorder to come to the realization, admission, and then to take the action so necessary to get on the road to wellness. Today, we're going to be addressing specifically that issue, how one gets into recovery with the necessary and proper treatment to begin the journey, the how, and even in some cases, the where. And we're talking about an organization that has the program down pretty well after nearly 50 years of service to the community, rebuilding lives and families. My guest is Victoria Blacksmith, CEO of both Granite Wellness Center and the Granite Wellness Center Foundation. A first-generation U.S. citizen, her people originate from Guadalajara, Mexico. She is currently a clinical psychologist doctoral candidate and is passionate about research and addressing historic inequities our minority populations experience. Her research on mental health has led her in the direction of the restoration and acceptance of cultural practices and values that have since been abandoned, removed, or outlawed. She has served as executive director for the Friendship House Association of American Indians, as a supervising detention officer in Yolo County, and provides individual psychotherapy in her private practice. Her awareness and familiarity with those in our community experiencing substance use disorder and its greater effects is well understood, and our conversation provides some great insight into both the gains that are being made addressing this issue, but also the limitations and challenges we're having in getting more done. Victoria Blacksmith, welcome to the Nonprofit Podcast Network. Victoria, welcome to the Nonprofit Podcast Network.
Thank you for having me.
Granite Wellness. I mean, the name alone conjures up images of stoic health. It's solid. And you're one of the largest substance abuse and related behavioral issue organizations in the region, correct?
Yes, that's correct.
Yeah, tell us what the primary service of the organization is and what your regional territory is, what counties you serve.
Yeah. Okay. Well, thanks for having us, Jeff. Happy to be here. Granite Wellness Centers is primarily located in Placer and Nevada County. So we have our largest location is in Grass Valley. It's what we call the campus. And that is kind of your one-stop shop. Essentially, every single service we offer is available in that campus in Grass Valley. We also have locations in Nevada City. We have locations in Truckee, Lincoln, Auburn, and Roseville. So we span both Placer and Nevada. However, we do provide services outside of just Placer, Nevada. Essentially, all surrounding counties we have some contracts with. So Yolo County, Amador, El Dorado, Sutter, all of the kind of surrounding counties. And I think it's because we have such a vast array of services available kind of under one roof. It makes it really easy to follow that individual through their treatment process. And then it just makes it so much easier on the client themselves to not have to go, from one place to another. So the main focus of what we do is substance use disorder treatment. And we treat adolescents, all the way through adulthood, at varying locations and levels of care. So we also treat individuals with co-occurring disorders. So that's individuals that have a mental health disorder that is either originated as a result of substance use disorder, or the substance use disorder is exacerbating it. It's making it more difficult for them to function. So it's an array of services of preventative. We have outpatient services, intensive outpatient, residential treatment that varies a couple of different levels. So essentially, anything you need when it comes to substance use disorder, Granite Wellness can provide.
And I'm going to ask you a question. This isn't one we talked about, but I noticed it in your language right now and also on the website. Substance use disorder versus what we would have normally said substance abuse, one and the same, rephrased for a reason.
Yeah, absolutely. So I think, the DSM has made some changes over time on different disorders, what we call them, and reducing the stigma around it, right? Because I think when you look at the term substance abuse, you immediately have a negative connotation with the word abuse, right? And so we know that substance use disorder is a spectrum, right? Because we have individuals that absolutely have no problem engaging in a couple of alcoholic drinks or recreational marijuana use or whatever that looks like, and then it goes all the way to the other end of the spectrum where now their life has become unmanageable. So it's a spectrum, and I think changing the language to substance use disorder removes a lot of that negative connotation, that negative stigma that I think people experience even when trying to get help.
And I agree. I think that's a great choice of words for a diagnostic of some sort, because not only is it a disorder, but it is a spectrum. Some people, it's 2 or 3 drinks. Some people it's a 6-pack in an evening. And it really is something that can be managed better, I think, if you understand where you are in the spectrum as well.
Mhm.
It's polarized, from 0 to 100. If you're at
Yeah.
100, you've got a real big issue.
Absolutely. And I think, we've evolved in how we look at and how we treat substance use disorder. In the past, the majority of treatment facilities were an abstinence based model, right? 12 steps, you got to go to this many meetings, you can't drink, you can't. What we've learned and what the research tells us is that that doesn't work for everybody. It's not a one size fits all. And so a harm reduction model, which is the language that you hear a lot as well, is what we focus in on as a social model, not necessarily a medical model. So we're taking a look at not just the individual and the circumstance that they find themselves in, but let's go another step, broader than that. What does the environment look like? What does their social supports look like? What does their family look like? And how do we support all of those different components to create an environment where they can better function, right? Where they can have better quality of life. And for some individuals that means abstinence, but for other individuals it might mean something else.
Just for the benefit of the listener, on your website, I mean, your services are overwhelming, in some cases, and I can only imagine the requirement that you've got to have them all practiced. But you've got inpatient programs, outpatient programs, medical services. I'm reading this: detoxification, DUI classes, recovery residences, adolescent treatment, parents and family services, life skills and wellness, even testing services. I
Mhm.
mean, that is a comprehensive list of services for care. Give us a little bit better understanding about the depth of those services and maybe what you see as most frequently used.
Yeah, definitely. So one thing is our website, it is a lot and it is under construction. So you're going to be seeing a completely new website in the weeks to come to make it a little more user friendly, and easier to navigate because there is a lot, right? So I think the number one need that we're seeing, our county providers and the individuals that we work with seek is detox services. So that is an individual who is currently utilizing substances and requires a medically monitored detoxification from that drug. At times, it will require the induction of certain medically assisted treatment, right? So different drugs that'll help them get through that process, and that's the number one need, followed by just standard residential treatment. So individuals that need, they need to come and live with us for a little bit and have a change of environment. and really focus 100% in on their recovery and themselves. That's what we're seeing as the second most frequent need is residential treatment, followed by our outpatient, intensive outpatient, and kind of all of our other programs. I think the most important thing, though, for individuals to just be aware of is if you need help, you don't need to worry about what kind of help. If you just know you need that, you reach out to us, we will help you navigate where would be the most appropriate space to enter treatment, right? Because we'll conduct some assessments and determine based on the current situation that these individuals find themselves in, what is it that they would benefit most from.
Mhm.
So it is a lot, but it's also because we want to make sure that there's access to essentially every point of entry potentially necessary, right? Because we hear a lot about individuals when they are seeking certain treatment supports or whatnot from primary health that, oh, you don't meet criteria for this, but you meet criteria for this other thing. And that just might not feel right to that particular client. And so in this space, we do definitely take into account what is it that they're saying they need, assessing, and then inserting them in all of these components. And for one of our clients, if we, let's say, put them in an outpatient setting and they're like, "Ooh, my cravings are really high. I'm not feeling safe in this setting. I think I need a little bit more." We will absolutely elevate their level of care, to keep them on that journey.
And if I'm not mistaken, two of those are inpatient. So detox and resident services obviously are inpatient, and the third is outpatient. What volume can you handle on detox and resident?
Yes. So currently we have two residential locations. One is located in Grass Valley. It is a 40-bed facility, 20 men, 20 women. They're separated. It's not a co-ed facility.
Mhm.
On our women's side, we can actually also accept up to 12 children. So that's what we're looking at in Grass Valley from a residential treatment standpoint. We have a capacity of 40 adults, 12 children. At any given time, we can have up to 8 detoxes out of that 40 count. But it varies. It's a lot. It's a lot for our medical staff, so it varies.
Mhm.
But we can take 8 in that location. In our Nevada City location, we I'm sorry, we can take 4 in that location. In our Nevada City location, we can also take an additional 4. So we have 8 total detox beds. Our Nevada City location is a co-ed residential treatment. Um, and that location can hold up to 27 individuals. So
Wow.
in a residential setting, we have capacity for a total of 47 adults, 12 children. In an outpatient setting, we can handle essentially at the moment as many clients as necessary. At times we will have a short wait list, but we're talking about a week or so before individuals are able to get an intake, but they will be contacted um, almost immediately following their application. So
That's really encouraging to say that you can accept somebody almost immediately, even if it's just within a week. What is the not the capacity, but the usage of the facilities in terms of the inpatient facilities? Are they pretty much full all the time?
yeah, so I mean, and I think it's because we offer kind of that continuum of care that we call it, right? So
Mhm.
if an individual enters detox, most of the time they will transition into residential when they're done with that detox. So they go from that level of care to residential and then the warm handoff to an outpatient setting. So it does at times create a little bit of a bottleneck, right? There's definitely more need than there are beds available,
Mhm.
and that's a statewide problem. But as an organization, it is something that we deal with as well. So we do prioritize certain populations, right? So our perinatal women, so IV users that are pregnant or they have children, those are definitely a priority. There's different criteria that can help individuals get in a little bit quicker. But the wait time is, it is what it is, and it fluctuates because also as individuals enter care, some people are like, oh, I want to go to treatment for 30 days. And it's like, well, that's all great, but well, let's figure out what you actually need. And some people end up identifying that they need a little more. They need 60, they need 90. And so that does impact the flow of individuals that can come in.
Oh, so somebody could be in residential treatment for up to 90 days, or is there a threshold of time that they stay?
There isn't really a cap. So I mean, I think residential treatment, it depends on the individual. In the past, our Medi-Cal system did limit individuals to one residential treatment stay, maximum time of 30 days once per year, which is like,
Mm.
that's not a reality. And so they have that changed about a year or two ago. And so now individuals essentially can enter treatment utilizing their Medi-Cal benefits as often as they need to. And then for us, we determine what it is that client needs. But yeah, people can stay up to a year.
Mhm.
It really depends on them, right?
You hate to see a frequent guest. You don't want them recurring. 30 days out, "We'll see you next year." That
Yeah,
let's get them healthy and get them back into, productive citizens as opposed to recurring issues.
absolutely.
You know,
Absolutely.
we're talking about the active care part of it. Is there anything that is relegated to preventative support?
Yeah, so I think, we have a pretty robust adolescent program. And so I think our adolescent program is really looked at as early intervention and preventative services. So we have some relationships with the local schools. We have a therapist that goes into the juvenile hall once a week to provide some of those services. And then we also have services here in our outpatient setting for our adolescents. And so it's probably one of our biggest, preventative and intervention services. We don't want to see these adolescents as adults come through our program, and so I want to say that we've been pretty successful in that space. I've heard only a couple of one-offs where it's like, yeah, we used to take care of him when he was an adolescent, him or her, and now they're entering residential. However, that's also a pivotal time. If we get what we call a transitional age youth, a youth 18 to 24, extra supports are given to them even if they enter a residential treatment center setting, because we know how important it is to support them when they're in those early stages, and that could prevent them from coming back later. So adolescent is one. We have an amazing mothers in recovery program, and I would consider that a preventative program as well because it involves the child, right? So while mom is receiving treatment and learning to become, a better and more responsive parent, that child is also, getting some assessments done and ensuring that they have all of the supports that they need. So that would be a preventative component for that child and maybe future children. And then I think, taking a look at our DUI program, because our DUI program, we have first offenders. We have individuals they've never had a problem with alcohol before. This is their first run in with law enforcement, and they're now required to complete some DUI classes. And so providing that service in itself is absolutely a preventative and early intervention. Like, hey, this is your first time. Here's what it looks like, but also here's what it has the potential to look like if we don't get this under control. It also allows us to screen individuals at that point in time to identify if maybe they do have something a little more serious that they might need some additional support in.
That's wonderful. I love the fact that you can catch them in a situation, especially with the DUI program, because so many people make that one mistake and it's not recurring. It wasn't intentional. It was just foolish, not thinking of the
Right.
consequence. It was 2 drinks versus 1, and it puts them into that situation. And those seem to be very remedial. Once you run
Mm.
through that DUI program, you're done. It's not going to happen again. So I really like that. And same with the mothers and children, just the education and just the understanding. So those are great preventative services. How about your staff? What does the staff look like? How many people do you have? What sort of licensing do you require? I mean, again, because your organization is so big, I can only imagine the size of the team of people that you're working with.
Yeah, so we have about 104 staff at the moment. We do have some open positions, and always looking to grow. And so because we do so many things, right? We do have pretty much a pretty big spectrum of individuals. So we have, some individuals that are what we call residential support staff. So they are there to support the counselors and support the clients. It's a entry level position, and that transitions into like a certified peer, right? So getting some additional education and some support in that space. And then we also have our certified counselors. And so these are, alcohol and other drug counselors that are focused specifically on substance use disorder. We take interns who are currently going through that program. And then as they finish school and become certified, we also have placement for our certified counselors. We also work with practicum individuals, both obtaining their bachelor's and their master's degrees. We take interns. We have great relationships with local colleges. We have, a couple of licensed individuals that are some of the most amazing clinical supervisors I've seen who take in these interns, and they get this great opportunity to work in so many different modalities, right? So when you have like a master's level intern that has to have a little bit of a family component, crisis intervention component, and then, this other component, we can offer that all under one roof. And then, we have other individuals who provide maybe more of a specialized approach to some of these populations. So we have therapists that are solely focused on our adolescent team. We have therapists that are solely focused on our mothers in recovery, and then therapists that just do a little bit of everything. So it's a lot of moving parts all at once.
Well, 104 is a lot to begin with. And no shameless plug. What do you need? Let's put it into the episode and say what you find are some of the services that are short-staffed at this point.
Yeah, so our biggest need is substance use disorder counselors. And I think that the gap exists because some people might not know what that profession really is. I think a lot of people go directly licensure route, which is absolutely understandable, but there's also an opportunity to give back to your community, provide that direct kind of clinical support without all of those additions, and that is where we're finding ourselves having the biggest gap. And so what we also offer is if people are interested in that, they have some interest in mental health but they don't know how to obtain certification, or they might have some financial barriers in order to do that. We offer all of those components with individuals. So I think it's a beautiful thing to take somebody that's really green but has the great heart, and to be able to mold and mentor and teach them all of the amazing things that come with taking care of our community and engaging in somebody's treatment process. And so, but we also welcome our very experienced individuals that bring a wealth of knowledge to the field as well. But substance abuse disorder counselors, if you're interested, if you don't know what it's about, check out our website, send us a little message. We will walk you through.
We'll be back with Victoria Blacksmith on the next steps one takes to get engaged with Granite Wellness right after this. I was in the media business for over 35 years and had the great privilege of working with Runyon Saltzman, RSE, Marketing, Advertising, and Public Relations. We collaborated on many different campaigns, but their commitment to the nonprofit sector hasn't changed since their founder, Gene Runyon, started the agency. Over many years and many campaigns, Runyon Saltzman has been committed to improving lives by tackling California's most challenging issues. Guided by research-informed strategies and insightful, creative solutions, RSE develops innovative communications campaigns that raise awareness, educate, and reduce stigma in diverse communities throughout our state and beyond. To learn more about RSE, visit rs-e.com.
Hello, this is Scott Thomas with Cap Trust in our Sacramento office. I specialize in working with local nonprofits and associations. Annually, we survey private and public nonprofit organizations across the country to better understand challenges they see in today's environment. In our more recent survey, we heard concerns about proper board governance, mission-aligned investment, and how to implement alternative investments. If you would like a copy of the survey or to discuss your organization, look me up, Scott Thomas at captrust.com.
I'm thrilled to have Western Health Advantage partnering with us as they do so much to support so many nonprofit agencies in our community. As a truly local health plan, you'll find individual and family options, employer options, plans for CalPERS and Medicare Advantage. From medical services to pharmacy, health and wellness support, as well as behavioral health care, Western Health Advantage has a plan that fits what you need. As an employer, for profit or nonprofit business, individual or family, you can find more at westernhealth.com. How does one begin the journey with Granite Wellness? How do I get to you? Am I self-administered and saying, here I am walking through the door? Am I brought to you through a program? Does the school recognize the student with a challenge? Is it law enforcement? How do we get to you as somebody in need?
It's a great question. And actually, all of those are entry points. So we do have direct relationships and contracts with our county partners. So Placer County Nevada County, Yolo County, right? So if these individuals are Medi-Cal recipients in those particular counties, they can go directly to their county and seek that support. If they're having difficulty doing that, they can approach us and we can initiate the conversation with that county. We also accept all private insurances except for Kaiser and Medicare. And so if individuals have private insurance and they're interested, they can jump on our website and hit the contact us page. Somebody will get back to you within 24 hours to navigate that piece. But we do also work with a lot of law enforcement agencies that call us directly. But we have a lot of individuals that just reach out. They reach out and we're their first point of contact and we just help them navigate those pieces.
How about collaboration with other nonprofit organizations in the counties? Do they also bring people to your services where they're over capacity? They can't handle that many?
Yeah, I think we have a lot of great relationships with local entities, and then in some areas where we know that we don't have the capacity to serve, we will refer out and they will refer in. So I really, I like to look at what we do in the nonprofit world, especially when it comes to behavioral health. There's no competition here. We're all trying to heal our communities, and so however we can work best to support them, whether that's a referral out or what have you, then that's what we do. We meet the client where they where they're at. And so here we work a lot with some of our like housing county partners so that we can support clients getting into long-term housing. We work with some of the partners that do medication assisted treatment here in Placer County, so that clients can receive some take-home medications or whatever it is that they may need. But we absolutely partner. And if anybody's interested in partnering, let's have a conversation.
I love that comment right there, because I know through the program of many of the organizations, they're at capacity. And their biggest frustration is they just can't serve anymore. We know the need is there. And because you have such capacity, it just makes sense for their overflow to possibly be handed off into another treatment program or care facility where they can get the appropriate need. And that's amazing to know. Do you have any stories or any situations where you could exemplify something? Here's somebody that came in through the program, successfully reassimilated back into the community that you could share.
Yeah, I think, the biggest ones that stick out to me are who we have currently on staff. And so I think we have a lot of clients who have, a great experience when they're in treatment and they're able to get their families back together, right? Women who get reunited with their children. There's a big family component of what we do. We provide some family therapy as well. It's a component of additional kind of support and services, right? Like individuals want to go on a weekend pass. Let's make sure we've got your family involved in our treatment process. And so in those spaces, what we've seen individuals who start in residential, they have their family engage with them in treatment. And we see them go to outpatient. We see their family continue to get also that additional support through the community. And then we will hear, I'll be back, because our policy is 1 year. You got to give us 1 year being out of the program. And we will consider you for an entry-level position with the organization. We will put you through training to become a peer. And so we have had individuals who, this is our 50th year in business, by the way. So we've had individuals that have come through our program, have successfully graduated, have come in through an entry-level position, have gone back to school and received higher education and are now in administrative positions in the organization. And so those are some of the most beautiful stories because you get to continue to watch the story play out, but then you also get to watch these individuals kind of pour their own story and their own experience and energy back into the organization and into our community.
That's the familiarity part where hey, I've been through this. Don't tell me you can't do it. I've been through it.
Right.
I'm here. I'm with you. I understand. That's amazing that you have the semblance of people who go through the program and then come back in to look for employment. Wow.
Absolutely.
Yeah, I would imagine in many cases, it's probably not the situation. Who wants to go back? I don't want to revisit that situation ever again. We've only skimmed the surface of the significance of what the organization provides. I mean, the complexity of support that you've got, I can only imagine the complexity of compliance that you've got, that you have to fulfill for the state and for all the other services. But it's a huge, huge benefit. Uh, some things are changing. We talked a little bit about this in the pre-call, and you had some exciting news that you are now engaged with on some additional programs, which is why I didn't ask, are you multilingual? But I think you're going to answer that in this question. So what is it that's going on?
Yeah. So, one of the things outside of Granite Wellness, one of my passions is cultural appropriateness of services. So, as I'm a practicing clinician myself, I'm first generation in this country, and so understanding some of the cultural differences that individuals experience as they navigate just the healthcare system in general, but also what we look at from a mental health perspective as being protective factors, as being components of health might look a little bit different to the non-dominant culture in this space. And so I'm really, really happy to have entered into a partnership with Sutter Health to focus a pilot program in Lincoln on our monolingual Spanish speaking community. So one of the things that we've identified is that, so yes, we provide services in Spanish, both in Lincoln and in Truckee. And we're able to provide some additional supports in that space, but that's one of my biggest things. So if we have a client who has a cultural need that somebody else hasn't been able to fill or meet, we will work our butts off to try and make that work. It might not look the best, but we have tried and partnered so much with our counties to try and ensure that we create an environment and a space that is inclusive to everybody. But what we're working on with Sutter is this program that's going to focus on providing these wraparound services for the individual that's engaged in treatment and their entire family. We anticipate, being able to serve about 10 families during this pilot period, where the entry point is going to be those that are enrolled in an outpatient or a DUI services. However, we will assess the whole family unit and identify what are the needs that family has. How do we engage in preventative and early intervention methods to ensure that other individuals in this family don't end up needing our services? But one of the biggest components of that program is that it's going to be culturally specific. So we are going to ensure that all of our staff are bilingual. We are going to ensure that they are bicultural, because that component of culture isn't learned, it's experienced. And so we're also looking at bringing out traditional practitioners to be able to provide, limpias for our community, things that we engage in our home countries, our different home countries, that to us are a component of our health and well-being. And without those things, we are not well. In the Western kind of lens of looking at those things, that's not even a factor, right? It's
Right.
not even a thing. And so it's really important to be able to provide that space to our community. And so, we are in the capacity building stages of that program at the moment. And we anticipate being able to open our doors in September of this year, which will be perfect because it's Hispanic Heritage Month in the month of September. So it aligns really well. And if that pilot goes well, my hope is that the next step would be Granite Wellness opening a small residential treatment center that provides all of the programming in Spanish. That's something that doesn't exist. It's definitely a need. And so, hoping that is something on the horizon for the next year. Additionally, we are looking at expanding our detox beds in our Grass Valley location. So we're looking at doubling the detox capacity that we have from 8 to 16 to better meet the need of the state and the community.
It's such a blessing that they have somebody of your capacity at the leadership helm, because you are monolingual, you are culturally appropriate, you do understand, and you can see both sides of it. And one can only imagine the frustration of somebody who is monolingual gets into a situation that's less than desirable, or possibly substance use disorder. Where do they go in a place where nobody understands them? I mean,
Yeah.
that just fuels whatever the root cause of the problem is in the first place. So I think it's a wonderful thing to be able to get to that monolingual community. And they will grow into, as you have another program that is teaching English. So
Absolutely.
they can just flow through the entire process, and get themselves back into, an assimilated position to where they're productive and the families are healthy again. So that's, what a blessing that you're in this position. One thing that we ask before we close every one of our guests is, what's the greatest need? What do you see as the greatest need? And I put a little caveat because most of your stuff is funded either through Medi-Cal or through the insurance process, but you still have needs that are different than some other organizations. What is it?
Well, I will say that even though treatment is paid for by, by Medi-Cal or by private insurance, it's still very limiting to that particular client. So in this program specifically that we're going to open in Lincoln, for example, if we were to solely leverage Medi-Cal benefits, that individual would be the only individual that would be permitted to receive treatment, and they wouldn't be permitted to receive other types of supports that we're going to be introducing. So that funding is where kind of Sutter private donors and things of that nature come in, right? Being able to provide the full spectrum of services and not just the limits of what our health insurance world allows us to do is really where the biggest need is. And so, private donations that come through could help fund an individual who, for whatever reason, doesn't meet medical necessity with their insurance company for treatment, but so desperately is dying to get into treatment, right? And they make too much income for maybe Medi-Cal. And so they're stuck in this space where now they have to pay for treatment on their own if they want it because everybody else has determined that they don't really need it.
Mhm.
Things of that nature, right? At times we also have, so when we have a mom that comes into treatment and, and she has her baby with us, and we throw her a baby shower and we make sure she has all of the things that she needs, and we send these kids off to school and we take them back to school shopping, and all of those things are not covered by insurance, but they're a component of health and well-being and making individuals feel safe and secure in the environment that they're in, where we need everybody's help to support those pieces. I also want to really quickly talk about in that space. And we also provide those recovery residents that, short-term housing when they're done with their treatment or when they're in kind of a more stable place. We provide homes for mothers with their children, as well as fathers who have sole custody of their children. That is also very hard to find. So dads with their kids can get that additional support. Also, those things are not covered by
And
insurance.
would those be considered transitional? So they've gone through the program. Now they're somewhere in that space in between of getting back
Yeah.
into daily routine.
So when an individual is in our transitional housing, they've completed at least 30 days of residential treatment, or they have been, clean and sober for a 30-day period. So they're a little more stable. They're enrolled in our outpatient program or in another location's outpatient program. It doesn't matter as long as they're programming, and they are slowly working towards, being 100% independent. This is a short-term 6-month stay with us, where they get all of the supports that they need to get them to that next level. And so we have currently in that space, I think we have about, where is that? We have 59 homes available, or beds available for that transitional housing space. So in that space, donors are really really helpful in helping those families better prepare for what that next stage looks like.
I'm so glad you clarified that because it's easy to assume that everything's taken care of, and then you just get your reimbursements and everything keeps functioning. But to your point, I can see that. We know that in our own medical care system to
Yeah.
begin with the best insurance. No, that condition's not covered, or no, you're going to pay for that out of pocket. And our underserved and most vulnerable, that's the last thing they have is money for care. They're worried about rent and car and getting back and forth to work or their children or whatever it may be. So and God forbid, the last thing we want is for them to end up falling into homelessness where they don't have a place to go and they don't have shelter, because that's just a cascading cycle of not good. Well,
Yeah.
I have to thank you for what you're doing. You have a massive role to play in the organization and managing everything, uh, but your team as well. All 104 plus, because you'll probably get a volume from the episode of people applying. But nonetheless, it's so significant and so necessary to have an opportunity to have the ability to walk in when you know you need care, when you know that something's wrong, especially if you have a family. And for what you're doing, for what Granite Wellness represents, it's just such a comprehensive program from start, diagnosis, treatment, transition, back is just incredible. So thank you for sharing the story, and we just appreciate what you do and what your team is accomplishing.
Thank you, Jeff.
I hope you enjoyed the episode. If what you heard moved you, please reach out to that organization and do what you can to help. If you like and appreciate what we're doing to support local nonprofits, please give us a positive review, subscribe, and share. If you're a nonprofit with an interest in participating in an episode, you can reach me at jeff@hearmenowstudio.com. If you have a need for the services or products our sponsors offer, please reach out to them. CapTrust, fiduciary advice for endowments and foundations. Runyon Saltzman Incorporated, RSE, marketing, advertising, and public relations, creating integrated communications committed to improving lives. And Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. The Nonprofit Podcast Network is a production of, is recorded at, and edited by Hear Me Now Studio.